My name is Alison Dimsdale. I graduated from the Duke DNP program in 2012. At the time, the reason that I started the program was because of the Duke faculty, the name of Duke, my excellent experience during my master's program at Duke. But I don't think that I truly understood what the DNP was at the time or what the potential for my career was. I think there's still a little bit of clarity that people just don't understand the difference between a DNP and a PhD. At the time, I was a nurse practitioner in cardiology, and really my goal was to take better care of my patients. That was my absolute overriding goal, and I wanted more education, more experience, more training in order to be able to do that. So when I started the DNP program, I made fast friends, we studied together, learned so much, and I began to understand that the way that I could care better for my patients was by understanding the evidence at a much higher level. I didn't need to read in a book or a guideline what I needed to be doing. I could actually read the studies, I could understand their import, their accuracy, and how it applied to the patient sitting across the room from me when I'm in clinic, and that was very important. What I didn't know was going to happen was that I was going to receive training and education as a leader. And that's what truly changed my career trajectory in a surprising and unexpected way, really. My capstone project was a practice redesign. So what we did was we took a practice that had advanced practice providers, NPs and PAs, working less than their scope. And we deployed them to work independently, collaboratively, to full scope of practice. This may sound familiar to you. This is what's happening all over the country right now. And we were able, in my capstone project, which was very small, we demonstrated an increased access to care for patients. So that was my experience in the program itself. What happened right after that was that I was recruited to leadership positions within Duke over ambulatory NPs and PAs, where we are doing this every day in every practice specialty. We're increasing access for patients. We're assuring high quality care for the patients and for their families. And this results in work-life happiness. APPs, nurse practitioners, PAs are working to the top of their scope. They're making a big difference in the care that they're able to give. And so that has then translated into a podium, really, where I can speak with leaders in our health system, leaders with other health systems, and speak on a state and somewhat national level to what nurse practitioners can do. The sky is the limit. We've got barriers that we need to overcome, but we can. We are ready and poised to become a part of the provider workforce that can change everything about the landscape of healthcare in our country. And all of that started at Duke with my project, and it just grew. And I was very surprised to understand that the leadership training, the finance, the statistics, all the things that students groan about became an integral part of my workday. And so at this point, I have 3 roles within the health system. I'm Director of Advanced Practice for the Private Diagnostic Clinic, which is the physician practice. I still see patients in cardiology, where my specialty is heart failure. And I teach in the School of Nursing as clinical associate faculty, which is exciting and fun. I don't think any of those opportunities would have been available to me if I had not gotten the training that I received during the DNP program at Duke.